Yakima Valley Community College Radiologic Sciences Program presents Radiographic Positioning. Clavicle.
Hello guys, how are you? Today's lesson is a clavicle. You probably remember Drea. She's going to be our helper again today. Clavicle exam is a one projection exam. We're going to use a 10 by 12 crosswise. Drea has a right shoulder injury. So today we're going to put the ID blocker towards her spine. Drea, could you just step here for a second? See how it's going to be towards the spine if it's a right side? If it's her left shoulder, the ID blocker will be towards her spine. Okay? So right shoulder, cassette is crosswise because of the shape of the clavicle, goes in the Bucky unit. Your patient is dressed in a gown, no underwear, no necklaces. We're going to do it at the vertical board because it's easier for the patient to stand. It's quicker rather than lying them down. The muscles helping them lie down, clavicle can be in pain. But what about a patient who's in shock, who might faint on you? You would be forced to do them in a recumbent position. Whether you do it vertical or recumbent, the criteria is exactly the same thing. We want 40 inches SID. You can't see it from the tube angle, but my collimator, my tube, is at a 40-degree mark. You need to have your table, your tube transversely centered to your table or your wall bucky. Here we go. You want a 15-degree cephalic tube angle, and the gauge, you'll know how to use the equipment by now. We'll have a 15-degree cephalic tube angle. The purpose of that, Drea, can you come here, is to take the clavicle. It'll actually minimize the natural S shape of the clavicle. It minimizes the S shape, and it throws the clavicle superiorly, trying to get the clavicle away from underlying ribs in the apice of the lung. So a 15-degree cephalic tube angle. In a vertical position, depending on your equipment, some of the tubes are detented, so you have to leave it at the 40-inch mark in order to get the X-ray panel to make an exposure. In the true sense, technical sense of the word, if you have a tube angle, you have to bring the SID in, if you remember, 1 inch for every 5 degrees. So instead of it saying 40, you'd have it say 37 inches, okay? Or in a recumbent mode, you'd have the gauge say 37. That's to maintain that 40-inch SID relationship. But again, in a vertical position, you may be forced to have it at the detent 40 mark. And you'll understand by now because you'll be heading for clinic here, if not real soon. Okay? My patient stands, her feet separated. And remember, the tube is transversely centered. You have sternoclavicular joints and you have the AC joint. Those are the two boundaries of the clavicle. This crosshair, and I'll open the collimator so you can see more better. This crosshair here is going to be into the center of those 2 points. So I'm going to step in front of the camera so I can get a good look to see if she is centered here. Okay. And I want her arms to her side, or it can be held if that's her natural position. But the patient may have to move side to side, feet separated, in order to get this crosshair right down the center of that clavicle. So I like that placement, side-to-side placement. The vertical placement, I have the sternoclavicular joint here, and if she was in a gown, you'd be able to see it. It will not be necessary for you to touch the patient. I'm touching the patient on camera because you can't really see what I'm trying to show you well on a digital image here. But in a gown, you will actually be able to see the boundaries of that clavicle. And basically what you're doing is you're putting the clavicle to the center of the film, both in a vertical relationship and a side-to-side relationship. Okay. Here's the top part of the clavicle, the superior portion right at the AC joint, and there's the lower portion of the clavicle. So if you look at this crosshair here, can you see that it's a little high? It's leaning towards the superior aspect of the shoulder. So I need to lower the tube down a little bit. Okay. There's the bottom of the clavicle, there's the top. Can you see now that this crosshair is coming right down between my two fingers, these two planes? So I've centered the clavicle this way, and I've centered the clavicle this way. Then I need to make sure that the film is centered to the exit point of the clavicle. See how I line that up? Clavicle's not very big. I leave my 12. You'll know how to use your gauges. This side comes down to her shape. I'm coming in close to the clavicle, approximately 6 inches this way. Side to side, I want it to the 12. I'm actually looking at the gauge of my collimation, and I got my 12. The collimator head will have a gauge on it, and I read 12. And then my ID, here's my R marker. I make sure that it doesn't get into the shadow of anatomy. I keep it outside of the shadow, into the corner. I make sure that the patient's shoulders are in the same plane. I have her taking a breath, blow it out, don't breathe, don't move, and I make my exposure. She is shielded. I don't know if you couldn't see that at the beginning. You've got the shields we've shown you before, or you've got this tripod from your clinical sites covering her reproductive organs. Again, just to recap, 10 by 12 crosswise, ID blocker towards the spine side. You center the clavicle. Look for its boundaries. Your boundaries are your sternoclavicular joint, the AC joint, the superior aspect, the inferior aspect, and center that clavicle to the center of the film. Tight collimation, approximately 6 inches by 12, and you put your L or your R marker on there on a lateral corner. And what the clavicle will look like on an X-ray image is that the S shape will be minimized due to the 15 degrees cephalic tube angle, and the clavicle will be near the apices or above the ribs. Thank you.